In next few minutes, I will present my understanding, because this is new slides I just prepared last night. And should we have, my thinking is, should we have a commonly and accept values in HTAi? It's context-free values. It can be universal accepted. For example, equity, efficiency, and HTAi also could help the government in priority setting, like which intervention is most important, and how to design the benefit package and guideline, etc. On the other hand, should we have values in the context of each country? Because there are so many understandings of values. It's much difference from country to country, time to time. And my third point is the values in HTAi should be consistent and supportive to the goal of a national health development plan. For example, in the last 3 years, we've been carried out a health reform, a new round of health reform. So the goal is to reach the universal coverage of basic health care for all China. So universal is the equity issue, and basic is the package design, benefit package design. So this is my understanding for the values in HTAi. Upon that, so I very briefly touch 3 questions. First is what value considered in the top level decision making. Secondly, what can HTAi contribute to the values, contribute to the national development of health, then the ways to streamline the other values. First is the value of China healthcare system. With the rapid economic development, Chinese government have put health, education as the priority of social development. Improving people's health are becoming the major tasks for all levels of government. In the last 3 years, last 10 years, we have set up our health insurance schemes to cover all the people in China. So how to provide equitable, affordable care in an efficient way is going to be a very tough issue. On the other hand, with the very limited health manpower and the limited financial budget, government had changed the policy from introducing and adopting new technologies, for example, new drugs, new medical devices, new procedures, to rational utilization of existing technology. And carefully introducing the new technology. Because if you look at the 3 years ago, all the policy, including the price, they encourage all the hospitals to introduce new technologies, new drugs. Thirdly, governments are becoming more and more concerned the affordability of both the health insurance schemes and the patient's out-of-pocket payment. During the last 3 years new round reform, loss of cost containment policy has been adopted In the process, HTAi has played a very important role to help the government to find the better solution to control the cost. Here's my understanding and the value and the consideration and the HTAi contributions. In what way HTAi could be supportive to the government's national health plan, health reform. So I won't explain this. I just list the value should be consistent with the national health objectives. Also, there's other important values like the policy drivers. You change the government, so you change the ideas, philosophies in managing the country. Also, the people's demand and the voice, you should carefully concerned, even for the rich and poor. And finally, there is two groups of people in the health sector. It's more influential than the HTAi recommendations. First group is, I should say, health personnel, especially doctors. They are more used to tell you what to do. It's very difficult to tell them what to do. And another is the group of people is entrepreneurs. This two groups of people are much more powerful. Especially nowadays, we are facing the economic crisis. Politicians always, or most times, they would like to stimulate economic development first. Therefore, the HTAi practitioners need to consider other facts to streamline the different values. For example, how to integrate the citizen and industries in perspectives, and keep them informed all during the process, and also put the patients first to maximize the people's health and well-being. I think this is my key points. Thank you very much.